The Maryland Department of Health started reporting COVID-19 cases by zip code this week. Now Johns Hopkins University is going one step further. They just launched an in-depth map similar to their global one that shows important information like demographics and hospital capacity for every county in the U.S. WMAR 2 News' Abby Isaacs explains the goal of this new map.
Johns Hopkins hopes this will inform communities and policymakers about what portions of the state are most impacted by COVID-19 and where more resources are needed. With just a few clicks, you can see a breakdown of what's happening in your community.
The confirmed cases by population, the total death counts for each individual county, and the fatality rate.
The new Johns Hopkins University map shows cases and deaths for every county in the U.S. updated daily. Experts demonstrated the features in a media webinar today.
When you click on Baltimore City, you'll get this detail that pops up that allows you to see at a glance the confirmed cases for your city, but this is typically reported at the county level.
From there, click on the thumbnail to see your local dashboard. It includes stay-at-home policies and effective dates, the number of deaths, and race, ethnicity, poverty, population, and health insurance data to show who is being most affected.
What are people's access to health care? What are their underlying health conditions? Do they have the kind of vulnerabilities that we know may make them more inclined to suffer severe disease or experience death?
Data also shows the healthcare capacity of each area. For instance, the number of ICU beds available.
If there are limited ICU beds, then we may need to think, as case numbers are rising in that community, how we either expand access in that community or potentially think about reallocating our resources elsewhere.
And on a broader level, it shows where outbreaks are happening to better track the spread.
Not all communities are affected evenly, and not all communities are affected at the same time. And so when we think about making decisions about where to deploy our resources, understanding what parts of the country are most heavily hit and what parts of the country may have additional resource is quite important to be able to do that.
There are some limitations to this map because it's from publicly available data. Experts say that the shortage in testing skews the percentage of reported cases that have died, that number would be lower if more people were able to be tested. We have a link to the map on our website, wmar2news.com. For WMAR 2 News, I'm Abby Isaacs.